doing any like opening the patient or doing any conventional surgery, so we can take the ultrasound. Okay, and for sure the doctor who's going to do the ultrasound applications, he should be doing like he should be having a advanced training skills, because even in order to interpret the black and white image, you need like to be familiar with the ultrasound. Even the nurse, later you are going to know like this is a stone, this is a blockage, and even we can use the ultrasound for complicated ERCP. We cannot go from the ampulla because if there's like ampullar lesion or cancer or anything, so we can do the rendezvous, the opposite way around. So we can go from the hepatic duct, then down to the common bile duct, and then switch the scope from the ultrasound to the ERCP. This is called a rendezvous technique. So yes, we have many applications. So again, it's going to be the only and the first EUS tower in Nigeria. So let's benefit from it the right way. And the most important thing is how to handle the scope. So again, because it's not only a camera on the EUS scope, we have the camera on the probe. So this is why it's much more expensive, and we need to handle it in the proper way. Okay, it's like our baby.
Yeah.
Okay. And one more thing, even
can we ask a question as we go?
Yes, please.
So the image for the EUS, is it similar to the
or ultrasonography? So yes. So this is the tower. We can use it for conventional endoscopy and also EUS. So it's going to be one workstation. Before we used to have the tower, and then we used to have the ultrasound machine. So to have one tower, it will offer like downsizing at the side. So even in small theaters, yeah, it's very good. And also the nurse, it will be dealing with only one workstation, like for faster preparation and to adjust the settings instead of like I'm here and then I'm here. So it will offer a faster preparation. This is the endoscopic system. So this is why we can put it on the same workstation. Okay, so the scope, this is the same just like the conventional scope, but we are going to connect it here, and then we have another connector to connect the to the ultrasound processor to get the black and white image.
There is no brought it up. What two other period of person is now here? Period of grace?
Favor.
Okay.
She's in doctor.
None of them can come. Let everybody come. Let everybody that needs to be here come. Please.
All the nurses.
The period, at least the period.
Only one period.
What's it? Is that
Favor. This is the keyboard for the speech processor, and this is for the ultrasound processor. For sure, you know when we have the trackball, it's for the ultrasound. It is waterproof, and the most common used functions you are going to see it very easily, and you can access it by only one click. So during the examination, I need to change like power Doppler, color Doppler. You can switch it immediately. You can change the frequency, the depth, or the image adjustments, ultrasound image adjustments very easily. So it's very user friendly. And you have the printer for sure. We can switch from here, because inside this one it has a software just like or a Windows, like a computer. So in case we are not going to on it and off it the right way, we are going to have a software malfunction. Okay, so this is why it's very important to follow the same sequence for turning it on and off. And don't worry about the time, because it's going to take like less than 1 minute in order to be on, in case like you have emergency cases or.
And assuming someone mistakenly, while turning off, for example, turns it off there first, how bad will the malfunction be?
Actually, it's not going to happen after the first time, but in
If
case
it
you
keeps
are
happening.
frequently you are doing this, for sure.
Okay.
Like some hospitals, it's on, then immediately from here
Yeah.
off.
Okay.
So for sure this is a problem.
Yeah.
Okay.
Okay.
So here I'm getting this image, no probe connected, because there's no EUS scope connected. So I'm going to press OK. And why we are not getting the signal here? So this is the ultrasound. Okay. Later we can. Okay. So here we have for the scope. This is the light connector. This is the video connector, and this is the ultrasound connector. Okay. So let me. So this is the linear ultrasound scope. Okay. So this is the ultrasound connector. Can you hold this part, please? Thank you. See the first part, it's the distal end or the tip of the scope.
Yeah.
I'm not going to hold it from here, I'm going to hold it from here.
Okay.
So this is the camera and this is the probe, the most expensive two parts of the scope.
Wow.
So this one I'm going to hold it
Be
like this
careful.
and be careful around this. Do you have a cabinet where you are going to store
Yes,
this
we
scope?
have.
Ah,
We have a
okay.
cabinet.
Okay. So can you come with me, please? And it's better to put the scope on the hanger first. How to connect this one here? Okay. Why it should be from this side? Because from here it has a less thickness than here.
Yeah.
It will not go like this. So like this and then rotate it. Okay. This one is very. Okay. Now we can connect this one. See this out. Oh, I'm going to put it like this. Okay. And push it till the end. Then I'm going to open this one. I need to align the white dot with the black dot. Put it like this. Rotate clockwise. Don't rotate from here. You need to rotate from here. Okay. See here, it will not rotate. Okay. It's still orange. Why it's not working? Because it's on the standby mode. One click, it will go to the active mode. This one, same thing. I need to align the white dot with the black dot. See here, lock. When it is locked, it will not fit inside. So we need to make sure it is released first. Then we need to lock it inside, put it inside, and then just lock it. Okay. So this is the pump. This is the light. Again, it's EUS endoscopic ultrasound. So the first button which the doctor is going to ask the nurse to push it is the picture-in-picture, because the doctor wants to see the endoscopy first. And what's this? It's the tip of the scope. It is a unique feature available in only Fujifilm scope. So because here the doctor will be confirming always the direction of his scope while doing the advancing or the intubation of the scope. Because imagine like here I'm going to have in Fujifilm scope. Sorry. So this is the camera. It is 40-degree oblique forward viewing. So I can see in front of me like the normal scope, and I still see the part of the scope. Other companies, you cannot see the tip of the scope. So it is like you are entering a door and looking like this.
Yeah.
Okay, but with Fujifilm scope, still you can see the top of the door, and then you can move forward. Okay. The second feature, also it's unique from Fujifilm, it's the slim distal end design. The rigid section, why it's rigid? Because I cannot move this part. Okay, so this is the rigid section, it's very slim. So when I have a slim rigid section, I'm going to have a better maneuverability, safer insertion for the doctor.
So the pivot is somewhere.
Yeah.
This is the part that folds. Okay.
None of the ultrasound manufacturers can do this maneuver. We have 150, 150, 120, 120, left, right, and up, down, 150, 150. So why I'm having this, which is better bending capacity compared to the competitors, because again, it's about the short distal end design. Okay, other companies, they have it much more bigger, so this is why they cannot fold or bend the scope. And it's very important in the ultrasound to have a bending or a flexibility of the tip of the scope. Why? Because sometimes, especially when I need to take a biopsy, before taking a biopsy, let's move here. So this is the biopsy, this is the trajectory. So the needle is going to come in this area.
Okay.
So maybe the doctor is going to activate the color Doppler. He's going to put the color Doppler here in case there is any glowing part, or in case there is any red or blue, it means there's a blood.
Color Doppler.
This is the color Doppler. Later I'm going to talk about all the functions. Yeah, don't worry about it. Okay, so in case Doppler, it means presence of blood. So in case there is a blood, the doctor cannot do the puncture. Why? Because he will affect the specimen or the biopsy. He needs to collect tissue and not blood.
Yeah.
Okay, so this is why he needs to find another location where there is no blood interfering between the needle or the tip of the scope and the object being targeted, or the target site. Okay, so this is what navigate, manipulate in order to find a better location.
So when you turn the tip, does this change to another direction, or you have to change it here?
No.
Like this now.
It is fixed.
Okay. So
because this one,
so this, for example, shows that you are going to be taking.
No, yeah. I got your question.
Yes.
So because this is a linear ultrasound scope, it's not the radial, it's a therapeutic. So I'm going to have an elevator like the ERCP scope. So when I have a maximum raise of the elevator, it's going to be here. Minimum is so this is the range.
Okay.
So the doctor is going to put his target lesion here, or the object, the mass here, and then he can do the puncture. Okay. So let me go back to show you one feature here. One more. See, doctor? So even in case I'm...
So this mode is like the endoscopy mode, just basic endoscopy mode.
Yeah, this one.
When you want EUS, you press again, it changes.
This is why it's called picture-in-picture. I'm going to have ultrasound, and then I can have both of them.
Oh, so when you are going in, this is the one we actually need to be.
Exactly. Okay. Let me show you one thing.
Can you magnify the window?
Which one?
Then you press again, and it shows. I think with this you can change between this and the picture in picture. This is the ultrasound, and then this is the picture in picture.
Okay. But I don't know if I got you correctly. You need to magnify this, the whole
No,
picture.
I think he was referring to this.
Only this.
If you want it to press.
In case we need to magnify this one more, we need a also bigger and bigger image.
Bigger.
Yeah. But this is the
This is
1:1 scale.
It's fine. You need help?
Yes, please, doctor. Can you free this one for me? Thank you so much.
Can stop there, please. This will record very well.
No, this is the brush. I'm going to use this brush as a needle. I'm going to show you one thing. And see, for the linear scope, this is different compared to the other scopes. And this is why the biopsy cap, it's different. So we cannot use this one to the other scopes, and the vice versa. We cannot use the other caps to this scope. Why? Because here I can mount or install the needle. So the needle, it can fit in this part, but it cannot fit in the other part like other scopes. Okay.
Okay, does that have a different kind of biopsy needle? The biopsy forceps?
what?
No, sorry, I didn't get what you're talking about.
Yeah. This one is different.
The cap.
Yeah,
okay.
and also this one, the connector is different.
Okay.
You remember the
The one for
conventional
normal
scopes? It's
endoscopy.
bigger.
Yeah.
And this one is different. It comes in a black color. This one it's
Okay.
gray. In order to
Okay.
differentiate between
Okay.
both of them.
But what advantage does that confer? It's just the structure. Or
Yeah, because I cannot install or fit the needle, the FNA or FNAB needle on other scope, but it will go here.
Oh, okay.
Because I need to have it like stable,
Okay.
because I need to do the puncturing.
Okay.
So see here, this is the needle. I can see the needle when the elevator is raised and when the elevator is lowered. So there is no blind operation.
Mm.
Okay, this is the also another
I need the
advantage.
resonance.
Yeah.
Okay.
See.
This is
This is the elevator.
Elevator.
Like the ERCP scope. Okay. And can I have a cup filled with water, please?
Okay.
The coffee is water.
who is that water? I want to leave like that. Do you need it in a cup or
No,
can you
use
use
it in
Yes,
like in
yes,
a
we
bowl.
can use it.
can you use it like this?
But I'm going to use it with this scope. It's okay.
It might not enter. Will it enter?
It's water.
Okay, let's use this one. Can you open it for me, please? And then I need a tissue, please.
Tissue? What?
A tissue, or a compressed
Just
dose.
bring tissue.
It's okay, thank you.
You want someone to hold it?
No,
Okay.
actually, doctor, you should hold this cup.
Okay.
So, first of all, the doctor will be going to go inside. Why it's not moving? Because the elevator is raised. So we lower it first. So you are going to go inside it. Why there is no light? This is the light.
Okay.
Okay. You are going to go inside, and then you are going to ask the assistant to go to the picture-in-picture mode.
Okay.
Okay. Then I can
See the wave.
yes, measure the pulsation.
Okay.
Do you know why I need to check the pulsation sometimes? What's the difference between the vein and the artery? It's the pulsation. Yeah, I'm going to say like the heartbeats, and then for the vein it's going to be continuous. So sometimes the doctor wants to differentiate between the artery and the vein. He's going to activate this one. Okay. Go back. Power Doppler again. Sorry. Biopsy again. Okay.
So the biopsy button, if you don't press it,
Okay.
does it mean you can't take the biopsy?
No, you can. You can still take the biopsy, but
Okay.
like
But
for
what does it do? It guides you.
It will tell you exactly.
Let me see what it does
Sorry.
when you press this.
Exactly where to put your lesion.
Okay.
So you need to put your lesion here.
Okay.
Okay.
Okay. And that you do that by the way you move the scope.
Yes,
You
exactly.
have to move the scope too.
Yes.
Okay.
Let's.
And then also use the up and down. This one, right?
Actually,
The elevation or no need?
No, this is the up and down for the wheels,
Okay.
but for the ultrasound scope, the
Yes.
most important thing is to dance with the scope. So
Okay.
see here, just do like this.
Okay. Okay.
So
to
most of the
move.
times you are going to do this. Forget about the wheels.
Yeah.
Okay.
Yeah. Okay. And what does the optimize do?
Okay. So I'm going to press it, and then you are going to see the settings changed.
Okay.
Like it's an automatical adjustment of the ultrasound settings.
To default setting.
Yes.
Okay.
Okay. Not default, to optimize the ultrasound settings. Like based on the readings of the ultrasound, it's going to automatically select the best depth and the best gain, best frequency for you.
Okay.
Okay. And what else? Semicircle. It's for the radial scope. We cannot use it for the linear scope because for the radial we have like this. We can choose half of the circle, either the upper one or the lower one. Same thing for the rotation. We can rotate just like the CR. We can rotate the anatomy of the patient. Here we have the dual screen. Let me show you the dual screen. Okay. I'm going to have two screens. One is freeze, and the other one is
continuing the other one.
real time. Okay, let's say I'm doing an RFA and I need to check the radio frequency ablation. I need to check before and after. So this is how I can. This is the real time. This is freeze. Also I can switch. This is freeze. This is the real time.
Okay.
I need both of them to be real time. Also I can do it. Let me go back to the V mode. Okay, let me remove the guy. And here I have simultaneous dual. Okay, I'm going to have two screens, both of them real time. But what's the benefit of this one? I can have color Doppler and the V mode in one of them, V mode and the other one.
If you want the color Doppler in the other one, what do you do? You just move the cursor.
No, I think it's always like the V mode is here. The V mode is always here.
Okay.
Let's say power pulse Doppler. Sorry. Simultaneous. Let me go back to the V mode. Simultaneous. Oh, I cannot have it with the pulse wave. I can have it with the color Doppler.
Okay.
Okay. What else?
So the semicircle, you said something about.
Okay, so normally we do the EUS after the normal endoscopy. In case the doctor sees a bulge, it means like there's something outside the GI tract, or after a CT scan, he's suspecting something. So the applications, one, it is the staging. You know what's the staging?
Yeah.
For sure. Okay, to also know the invasion depth, because the probe or the ultrasound transducer is going to be inside the patient's body, unlike the conventional ultrasound, where the probe is going to be outside. So when the probe is inside, near to the object, it's going to give more resolution, better image quality. So this is why we can use it for staging. Second thing.